Hi, my name's Alistair. I'm 49 years old and I don't have any underlying health conditions. To be honest, I feel like I'm one of the more fortunate people that may have contracted this Covid-19 virus because if I did get it, then it was a very mild version of the virus, which is a huge relief. Just to give you some background, I started working from home when the lockdown started on the 23rd of March. The previous week I'd been at work, my kids had been at school, my youngest son had been at nursery, and pretty shortly after lockdown he started to come down with a persistent cough and a temperature, which was a little bit worrying, but anyone who's had kids knows that kids get coughs and colds and temperatures all the time. So we weren't massively concerned and we monitored it all week. However, by the Tuesday of the following week, although he was better, I started to develop a very persistent coughing as much as once every 10 or 15 or 20 seconds, accompanied by a really sharp burning needle sensation across the chest horizontally, sort of crackling to the cough as well, very dry cough. I'd never really experienced anything like that in my life, and it became harder to breathe as a result. On the Tuesday evening, I took all the usual medications that you'd take for flu, went to bed, had a really tough night, coughing all the way through, again with the burning pain in the chest, and found it impossible to get up the next morning. When I got up at noon, I felt a little bit better, but wasn't functioning properly at all. The symptoms continued for another 24 hours, and then they started to subside, and I gradually felt better and better after that. I never had a temperature throughout the whole episode, although I did have an upset stomach for about a week. I decided not to seek formal medical help because I knew that medical services were overrun, and I knew a lot of people were in a worse position than I was. We just monitored it and hoped that it wouldn't get worse. My main emotions during that period were really anxiety that it would develop into something far worse, which it appears to be able to do very, very rapidly. Fortunately, that didn't happen. And the condition didn't really deteriorate. I was also worried about the capacity of the NHS and local hospitals to be able to treat me and other people in a worse position. I tried to stay positive by reminding myself that there were thousands of people in a much worse position than me, and also by thinking that if I had caught a mild version of the virus, then I might have some antibodies built up and some resistance and immunity that could help me to resist the virus in the future. It was only when I went to a pharmacy over a week later to get some stuff for other members of the family that the pharmacist confirmed that he thought that I had a mild version of the virus. My advice to others experiencing similar problems would be try not to panic. You may already be sort of short of breath. You don't want to make that worse. Stay vigilant and obviously act immediately. Call 111 if your symptoms deteriorate in any way. I'm hoping that catching COVID-19 will help me get back to work quickly with some immunity so that I can help others and hopefully not infect them. Thanks very much.